Thank you for having us. As you said, I work for Washington County Mental Health. I'm in the Human Resources Department. And I do have a presentation that I'm going to pop up and share with you that talks a little bit about our agency. So basically what I'm going to do is I'm going to go through a little bit of information about our agency and then get into some of the positions that we have available currently, talk about our benefits and a little bit about what it's like to work for the agency. Oh, sorry, did not mean to zoom in there. Okay, well maybe technology is not going to be my friend today. I cannot see how to unzoom that, so maybe I will just pull that down for a second. Sorry about that, guys. So we are based in Washington County, Vermont. So we cover from, sorry, I'm just going to unshare that for a minute. Waterbury down to kind of Williamstown's outside of our catchment area, but we cover some stuff around the edges as well. We go also up to, we have some stuff outside of our area in kind of the Danville area. Most of what we do is based within Barre, Montpelier, that general catchment area. And we have been around for the last 50 years. Sorry. Let me switch to, there we go. We are a private nonprofit. We provide services to a wide range of folks within our community. We have about 700 employees between full-time and part-time. And we serve, any given year, we serve over 5,000 individuals within our community. So it's a lot of, sometimes we might see somebody once or twice, sometimes we might be with somebody every day, and a lot of in between. I mentioned we've celebrated over 50 years of serving our community. We really try and provide customized person-centered services. So really looking at the individual and not sort of cookie cutter services, but really providing support based on what that one person needs. So talk a little bit about our mission and our vision. Our mission statement is that we advocate inclusion of all persons into our community. So, you know, by all persons, we really mean all persons. We encourage self-determination and recovery, and we serve all individuals and families, coping with both mental health challenges, developmental disability, etc. A lot of our services are trauma informed. So what that means is we provide training to staff on trauma and how that can affect folks and how to have a trauma informed outlook on providing those services. And our vision is healthy neighbors, healthy communities, and we want to lead the way to wellness through collaboration, inclusion, and compassionate care. And as we talk a little bit about some of our programs, you're going to see that collaboration. We work a lot with different partners within our community. We have 5 major divisions: Children, Youth, and Family Services, Center for Counseling and Psychological Services, the Community Support Program, Community Developmental Services, as well as Intensive Care Services. These buildings, all of our major locations in the Barre Montpelier area. So I'm going to talk just a little bit about the different divisions and the types of supports that we provide. So starting with intensive care services. So intensive care services really provides 24-hour crisis or emergency services to folks within our community. Our goal is to help address the immediate concern and then figure out moving forward what additional supports can we provide to help hopefully reduce the need for crisis services in the future. So one main component of that is our emergency services team, our emergency screeners. They are clinicians that are on call 24/7. They are community-based, they're a mobile team. So while our office is located across the parking lot from Central Vermont Hospital, we work quite a bit in the emergency room, in the community, and go where we are needed to provide those supports. Additionally, we have home intervention. which is a short-term crisis stabilization program. So it's folks who are in crisis and need some additional supports. And rather than going into the hospital, they may stay with us to receive those supports. It is a home-like environment, and studies have shown that more home-like environment can help assist in working through that crisis faster than a more institutional type setting. So our goal is to provide those wraparound supports, both psychiatric, nursing, supported counseling to those individuals. We also have a program called the Lighthouse, and that is where we provide supports to folks who have been involved generally with the police, who are intoxicated but are not at risk. So we help stay with them and provide supports while they detox, provide supportive counseling, and hopefully help them with services moving forward. So the police may have picked them up, and rather than put them in holding, because they haven't really necessarily done anything wrong, they're just intoxicated, we provide those supports to help them make sure they're safe, and then also figure out sort of next steps moving forward, what makes sense for them in terms of some support with that. Our Children, Youth, and Family Services division is our largest division within the agency, and they provide supports to, as it sounds, children, youth, and their family. I was going to say we start birth to age 22, but really we start prior to birth. We have a doula program where we are working with expectant mothers as well. Our early childhood services provide support to 0 to age 6. We have a daycare as part of that, where we are providing support to those youth who are either experiencing or at risk of serious emotional disturbances, as well as their family. We offer several highly individualized school-based programs, and when we talk about jobs, that's going to be one of those areas that we talk about. Providing supports to folks either in the public school, so providing behavioral support to kind of age 4 through 21 in the public schools, or we have our own independent school, Choice Academy, which also provides therapeutic services, mental health services to grades 5 through 12. We also have residential programs, so kids who have challenging behaviors and perhaps are not at home for many reasons. We have 5, I think we have 5 right now. Each program is a maximum of 4 kids, so it's not a large program, but we're providing support 24/7. They live there, we provide support within the home, we provide support within the community, as well as in the school. And then additional community and home-based supports, case management, respite, therapeutic foster care, so there's a wide range of supports that we provide. I'm kind of lumping together 2 of our divisions here to talk about adult mental health. So we provide counseling services, outpatient counseling, either individual, group, family, and a wide range of different types of treatment to help meet the needs of the individual we're serving. We also have some residential programs. So again, folks who maybe aren't ready at the time to live on their own, and we're providing support either transitionally, so helping them transition to whatever comes next for them, looking at housing, so maybe folks who need some support in securing housing, making sure that they have that support so that they can worry about other things and not that basic concern about housing. We also have some street outreach interventions, so a community-based program working with folks who are re-entering back into the community following some type of involvement with the criminal justice system. We also have what's kind of cool is a wellness collaborative. So we have a lot of we're not just providing therapy, but we're also providing a lot of other types of more holistic supports. So things like yoga, mindfulness, meditation, gardening. They've done tea workshops and journaling and art and lots of other types of self-care tools for folks, usually in a group-based setting to help address symptoms of stress in their daily lives. We also provide developmental services, so a wide range of community-based supports to folks with developmental disabilities, intellectual disability, autism, etc. We also do employment, so help find folks jobs and help them be successful within a job. We also have some residential supports for folks who either can't live on their own, or maybe they can live on their own but need some additional supports. And a bunch of different types of skill building, communication support, etc. So lots of different types of supports. We really have been doing a lot more wellness related and more holistic type approaches to things. Some of the photos we have up here, we have an art studio, yoga. One of the pictures in the middle is from a color run we did a couple years ago, the Do Good Festival. We have, up in the corner, we have the Imagination Station, which is a sensory room for folks with autism. It has lots of lights and tactile things, weight blankets and sounds and things to help support folks. We also recently went solar, so we have just some solar panels on there. In terms of jobs, we have a lot of stuff out there, starting with flexible schedule. You're looking for a flexible schedule, we have jobs to meet that. Within our children's program, community skills providers. That's a part-time job. Most people pick it up as an extra type of work to do, and it's working up to 20 hours a month with an individual providing support within the community. So working on building skills and helping them be successful in a variety of different ways. We are looking for supervised assisted living providers. So within the residential program that I mentioned, looking for folks to do the overnight shift with the kind of 10 to 18-ish age range. We're also looking for behavioral interventionists. So again, providing one-on-one support to kids and youth within the community settings. On the adult side, we are looking for residential counselors. So again, working on daily living skills, working on supportive counseling, and really helping people be successful and build skills. RAP counselor is within the street outreach that I mentioned earlier. So similar, working on providing supports to build daily living skills and work on that transition out of some type of interaction with the criminal justice system. On the intensive care services side of the fence, we just recently, brand new position, it's an embedded clinician within the police department. So it's going to be working with the police and going out on scene to police calls and providing mental health supports during that, which is, we're excited about being able to be more involved in that process. We work closely with the local police already, but we don't currently have anyone actively embedded in that program, so that'll be wonderful. Home intervention is our short-term crisis bed, so we're looking for folks to provide support to those individuals who generally would receive services in the hospital and providing those supportive counseling. Our public inebriate program, we are looking for folks to, the lighthouse that I mentioned earlier, looking for folks to provide supports there. We're looking for residential support specialists, as well as we have a new individual coming into our program, a young gentleman who's working on social, emotional, and behavioral goals. So providing some individualized supports within our intensive residential support specialist role, as well as behavior support specialist. However, we're not just 24/7. We also have a lot of programs or positions that are more Monday through Friday type schedule. Registered behavior technician in training is for someone who maybe doesn't have a degree and wants to work with kids. It's a program where we provide training to get that individual to receive their registered behavior technician certification. And we provide all the training and supports to enable them to do that. And they are working again one-on-one with kids within the school system, similar to our behavioral interventionists. So providing support, working on implementing a behavior plan and helping that individual be successful in school. Additionally, with school out, we have summer programming. So in addition to just working with them in the school, we also work on finding safe, predictable schedule for those folks. We do a lot of individual and group activities to help them be successful during the summer, make sure that that transition back to school is not difficult because they've been receiving supports throughout the summer. We're looking for a special education coordinator for our Choice Academy. Behavior clinicians, we've got a clinician case management position open. Those positions are master's level. We're looking for individuals with experience working with kids. We have an opening within our childcare, our daycare. So we're looking for a childcare interventionist. We also have a new program or a new grant that we received. It's called Children's Health Integration, Linkage, and Detection. So it's really a collaboration on working with, integrating with primary care and behavioral health. So providing wellness-based mental health supports. So that's the wellness coach as well as the behavioral health consultant are part of that program. We're looking for marriage and family therapist. We're looking for community support and employment specialists. So again, helping folks in the community or helping them be successful at their job, as well as we're looking for some maintenance folks. So folks to help with painting, fixing things, mowing, that kind of thing. So that's sort of what we have open. We have an excellent benefit package. We hire both full-time as well as part-time or per diem individuals. All of our full-time employees are eligible for medical, dental, vision. We have an accident insurance plan, flexible spending account, or a health savings account, depending on the type of medical plan you're enrolled in. We have a 403B. A lot of times people are like, what is a 403B? People are more usually familiar with a 401k. So it's a retirement savings plan. Same concept. We're a nonprofit, so that's usually where the 403B versus the 401k comes in. But we do offer a match of 4.25%, which increases the longer that you're employed with the agency. Employee assistance program, company paid short-term disability, company paid long-term disability and life insurance, which is 2 times your annual salary. We also have very generous paid time off. We offer 12 and a half paid holidays. We start off at 12 days of sick and 12 days of vacation, which increases over time to 18 days of sick and 24 days of vacation that we provide. So we really recognize that the work can be difficult and we don't want people to be burned out. So we want to make sure that you take time, take care of yourselves, and have some time with your family. This next slide, last year in one of our employee surveys, we asked folks, what keeps you doing what you do here at Washington County? We get a lot of interesting responses. Things like, the people I work with are supportive and caring, benefits of flexibility. I love my job, my team, my supervisor, director. I look forward to each and every shift. I'm constantly learning and growing. And that's something we really do try and do, provide training and supports for folks to continue to grow their skills. And we do have a lot of scenarios where folks start in one role and over time are able to move up within the organization. So again, just kind of leave that up there for a minute. There's quite a few comments just about what people have said. I appreciate working in a home and trying to create and recreate an atmosphere of home, belonging, comfort, safety, and encouragement. I think that says a lot because a lot of the folks that we serve don't always have that. So being able to provide that stable environment and supports so that folks can feel like they belong. And obviously, if you want to learn more about us, you can visit our website, email. You can obviously apply through JobsInVT. You can email us jobs@wcmhs.org. We also have Facebook, Twitter, Instagram, LinkedIn. You're always welcome to also reach out to us on any of those platforms. But that's us in a nutshell.
Kelly, I appreciate you taking your time and talking about Washington County mental health.
Thank you.